I was trained as an obstetrician gynecologist, so I completed a 4-year residency in OBGYN, and then I chose to specialize specifically in maternal-fetal medicine, which is the subspecialty that takes care of patients where either the mom has underlying medical conditions that might cause complications in the pregnancy, or the developing baby has complications that we need to care for as well. That initial visit, so if it is, say, a prior patient that we've known, we kind of re-examine the patient's last pregnancy, how that went, what we could do, differently. Will the management, end up changing this pregnancy? If it is a, consultation, we discuss, the reason why the patient's there, creates kind of a, comprehensive, care plan for their pregnancy, whether that is, continuing their care, with us, or putting together a plan for their primary, OB providers. I'm a big advocate of a preconception consultation. So there are many times when women have multiple, health conditions that would put them at having a very high-risk pregnancy. I love, forming relationships with my patients. It's to me, it's more than just, taking care of them in the moment, but it's really, learning about them as a person, because oftentimes you find, whether it's certain behaviors or other health habits, that might be taking place, that you can use in your education to kind of help, guide them and, guide them through a healthier, pregnancy.